Amen. Let's affirm me. I solemnly affirm that I will be faithful to the Republic of Namibia and its people, and I solemnly promise to uphold and defend the Constitution and the laws of the Republic of Namibia to the best of my ability. So help me God. Thank you very much. Welcome back. Thank you very much. Just a short announcement, honorable members. A reminder for the fun walk, which was duly announced. Fun walk tomorrow, 26 June. Where is coming? First, take note of the date. It's scheduled for tomorrow, 26 June. The Parliament bus will depart at 8 from the premises for MPs and staff that need transport. The walk will start 9 o'clock from the Heroes Eka police checkpoint, and it will cover for 10 kilometers. Looking forward to see you there. Okay. Thank you. Message from we are clear, ne? Last year it was Danville June, I think. This year they are just changing. Is this one to report? So Honorable Brinkman will know it better than any other person. Yeah. So the checkpoint is this one of Hiroseka on your way to report. You can do 5 kilos, you can do 10, but the idea is just to have continuously that. Transport is provided, but if you want to have your own transport, you can go directly there. The starting time is 9 o'clock. Okay. Message from the head of state. Any petitions, reports from standing committee, other reports and papers, notices of questions. Honorable Kalola.
Thank you, DP. We recently saw a televised meeting between the United States of America, Ambassador to Namibia, John Giordano, and Chief Justice Peter Shibute. During this meeting, the ambassador publicly directed the Chief Justice that if he or the judges...
Cell phone or maybe the earphone?
During this meeting, the ambassador publicly directed the Chief Justice that if he or the judges have cases before them, they must pick up a phone and call the ambassador so that he can call his friends or people he has connection with in order to help the Chief Justice and the judges to deal with that case. Given this information, notice is hereby given that on Thursday, July 2nd, 2026, I shall ask the Minister of Justice and Labor Relations, Honorable Philemon Wise Emmanuel, the following. Number one, the televised statements by the U.S. ambassador appear to contravene Article 78(3) of the Namibian Constitution, which protects judicial independence from interference. Given this, has the Ministry of Justice formally assessed the statements, and what is the official legal opinion of the government on whether these comments constitute an attempt to interfere with the judiciary? Number two, and the last one, has this arrangement been put into practice? And if so, can you provide details regarding the number of judges and specific cases involved? It is so submitted, Speaker.
Thank you. Please table the question. Honorable Angula.
At least sometimes I can get a chance to speak. Honorable Deputy Speaker, it's always wiser to plan for bad times during the good times. Just because we are enjoying the sunshine does not mean winter will not come. We've seen recent reports of Namibians complaining about low quality rice, which some have labeled plastic rice. This rice was given to them as part of drought relief program, and recipients claim that once cooked, this foreign rice turns into a porridge. This year, we've received better rains and farmers, particularly in communal areas, are expected to record a better harvest compared to last year. The harvest of white maize is projected at more than 100,000 tons this year. Furthermore, we saw that the Namibian Correctional Service farm at Divundu was experiencing challenges with shortage of their produce, risking tons of this produce getting spoiled. In this context, notice is hereby given that on Thursday, July 2nd, 2026, I shall ask the Minister responsible for Agriculture, Honorable Inge Damwami Kawin, and the Right Honorable Prime Minister, Dr. Shitunga Ngurare, the following. In light of the projected rice maize surplus of 100,000 tons, what specific mechanisms and financial resources have been put in place by the Office of the Prime Minister and the Ministry of Agriculture to procure the surplus directly from communal and commercial farmers? Can you articulate a clear timeline for this procurement to ensure the strategic reserve is replenished before the next drought cycle, thereby replacing the reliance on imported rice that has been labeled as plastic rice? Following reports of potential spoilage at the Divundu Correctional Service farm, can the government confirm whether the storage challenges at this facility have been resolved? Please provide details on the nature of the intervention, including whether new storage facilities were constructed, existing ones rehabilitated, or specific funding was allocated to the Correctional Service for this purpose. Third and finally, could the Prime Minister provide the current aggregate grain storage capacity of the government in metric tons, disaggregated by region and by the type of facilities such as silos or warehouses? Additionally, what is the current utilization rate of these facilities, and what is the projected shortfall if we are to store the anticipated bumper harvest? I so submit, Honorable Deputy Speaker.
Thank you. Please table the question. Honorable Shitana.
Thank you, Honorable Deputy Speaker. It's a government endorsement of candidate and chaos at the National Youth Council. We have witnessed the most chaotic General Assembly in the history of the National Youth Council. Disturbingly, the factional conflict that disrupted the Assembly appeared to have sponsored by the senior government leaders. The Prime Minister publicly backed a factional and a partisan position, and he, together with other senior leaders, posed for a photographer with one candidate, effectively promoting a participating in a division among the youth. The same senior government leaders who contributed to this division through endorsement and factional involvement are now taking moral position at the National Youth Council chaos they helped created. Against this background, notice is here by given that Tuesday, 2 July 2026, I shall ask the Ministry responsible for Education, Innovation, Youth, Sport, Art and Culture, Honorable Dr. Sanet Steenkamp, the following. 1. Does the Ministry support the senior government official, including the Prime Minister, involving themselves in a public endorsement factional and candidate at the National Youth Council? Please clarify the ministry official position on the cabinet member participating in a partisan and activity within the statutory youth body. Given that factionalism has been cited a primary cause of the chaotic collapse of the recent General Assembly, what specific measure will the ministry implement to ensure government officials remain strict on a neutral in future of NYC proceedings? What steps be taken to restore order and credibility to the institution in light of what has been described as the worst General Assembly in the history? I so submit.
Thank you. Please table the question. Thank you, Honorable Lucato.
My relative brother, Honorable Deputy Speaker, leaders of various political parties, members of Parliament, thank you for the platform. Today, Thursday, 25 June 2026, I hereby give notice that on Thursday, 2nd July 2026, I shall ask the Minister of Home Affairs, Immigration, Safety and Security, my relative sister, Honorable Lucia Ipumbu, the following questions. Honorable Minister, it is observed that Namibia continues to face higher unemployment rate, particularly among young people and the graduates who are struggling to score employment opportunity. In light of this situation, I would like to ask the following questions. Number one, can the Honorable Minister inform this august House and the Namibian nation how many foreign nationals are currently employed in Namibia, specifically within the government sectors and the private sector? Number two, what are the latest official statistics regarding the number of unemployed Namibian citizens currently residing in Namibia? Number three, how much revenue has been generated through income tax and other statutory contributions from foreign nationals employed in Namibia during the past 5 years? Number four, how many work permits are employment permits have been issued to foreign nationals in Namibia during the past 5 years, and which sectors are these permits hold primary employee? Number five, what measures and the policy has the government put in place to ensure that suitable qualified Namibian citizens are given priority for employment opportunity before employers recruiting foreign nationals? Second, what mechanism are in place to monitor and enforce compliance by both government institutions and the private companies with Namibia's labor and immigration laws regarding the employment of foreign workers? The last one, Honorable Speaker, Honorable Minister, does the government intend to review or strengthen existing legislation and the policy governing the issuance of work permits in order to address the country's high unemployment rate among Namibian citizens? If so, what specific reforms are being considered? I so submit, Honorable Deputy Speaker.
Kindly table the question, Honorable Member. Honorable Somai. No. Yeah. Oh. Honorable Lutuezi.
Thank you, Deputy Speaker. Honorable members, I hereby give notice that on Tuesday, the 30th of June 2026, I shall ask the Minister of Finance, Honorable Erika Shafuda, the following. The social grant is intended to provide elderly citizens with basic income, security to help them meet essential needs such as food and health care. However, many senior citizens who rely on the 1,700 grant to survive are now taking loans from NAMPOST using their grant as security. This is a serious concern because it suggests that many are borrowing not by choice, but out of necessity. as the grant is insufficient to meet their basic needs. This is why many of us has been calling for the fulfillment of the promise to increase the social grant to 3,000 per month, thereby enabling our elderly citizens to live with dignity and reducing the need for them to rely on debt for their survival. In this regard, I therefore ask the Honorable Minister the following questions. 1. What is the legal and policy basis that permits NAMPOS to extend loans to social grant beneficiaries using their grants as security or guarantee? 2. Has the ministry conducted any assessment on the impact of such loans on beneficiaries, particularly regarding debt and the effect on their ability to meet basic needs such as food and health care? The last one, what measures are currently in place to protect elderly social grant beneficiaries from entering into loan agreements that may compromise their financial well-being, especially where they may not fully understand the long-term financial implications of such arrangements? I so submit.
Kindly table the question, Honourable Member. Honourable April.
Thank you, Deputy Speaker. Mine is actually a point of privilege on the matter of yesterday.
Now, if that is, let me dispose the questions.
Yeah.
Okay, Honourable Nashinge. Honourable, yeah.
Yeah, thank you. Thank you very much, Deputy Speaker. Good afternoon to all of us. I just have a quick question to the Minister of Home Works and Transport, Agent 1. This week we read in the newspaper about the happenings of the activities that are happening or had happened at the Namibia Airport Company. And we are just being fed by the newspapers. Just wanted to ask the Honourable Minister as to when is he going to come with a ministerial statement to put facts on the ground so that the citizens will truly have well-informed information coming from the person responsible for the ministry, which is the custodian of that institution, including perhaps attaching the report that is being quoted by the newspapers so that we can also read ourselves and inform ourselves and have a better position to what has really been happening there, as well as the comprehensive, I believe there was a comprehensive report that came from the institution, hence the report or response, comprehensive response, I believe, that ended up producing the report that the newspaper is telling us. Thank you very much.
Thank you. Minister, the question is just when are you coming to bring a ministerial statement?
No, thank you very much, Honourable Speaker, Honourable Member. My intention was to finalize the internal process, and we have given the members of the board until 25. When is 25? Today or yesterday?
Today.
Let me check the date here. Yes.
Today.
So yeah, they were given until today to show cause why the minister cannot take action against them, but they have asked for extension until the 3rd. So the intention was to allow that process to run its space, and then I inform the Parliament and the public accordingly of all the facts. That was the intention. But well, this is the House. If the House feels that it must be done before that, I'm at your disposal. So depend how you direct it.
Okay, thank you, Honourable Somaip. Honourable Somaip. No, let me dispose, Honorable Suma, because the minister says, your question was, when are you addressing the House? The answer is, the due date to the board that reports to the minister is the 25th. But the board has, before the 25th, requested for extension until the 3rd. So the information... Come again? Honorable Nekundi?
Yeah, these individual members, they are not communicated no longer as a pack of a board, is now individuals. So the individual member of a board who must individually show cause, they individually have requested that they be given extension to show cause why by the 3rd of the 5th. There are 5 board members. The 4 have requested for the 3rd, 1 have requested for the 7th. It was declined, and all of them are to respond now. It's now extended to the 3rd. So the intention is now to report back only after that.
The 3rd?
Yes.
Okay.
That was the intention, but it's otherwise I say.
Please, you see... Okay, you see, Honorable Nashinge, when you see this way, I don't want... When I allow you clarity, then every other person, I must do it like that. It's an urgent question. You have posed the question. The minister says he will come after the 3rd. So therefore, I think we are on good understanding that after the 3rd, the issue will, we expect a House before we rise on the 9th to be abreast. Yeah. Honorable Somai.
Thank you, Deputy Speaker, and good afternoon, honorable members. Say good afternoon.
Good afternoon.
Yeah. Deputy Speaker, my oral question goes to the Minister of Home Affairs and Immigration. Yeah, we as peaceful Namibia country allowed foreigners in our country, and we have also based them at a certain, what is the place? Osire. But what I've realized now is these foreign nationals have infiltrated our towns, and all over Namibia they have opened spaza shops. And what I pick up is they are not only trading with goods, but they are also selling now drugs in these spaza shops. There is a case now that is undergoing in Ochivarango, that a foreign national was arrested in possession with medicines. And even not with medicines, but these people are producing drugs, getting medicines from hospitals, ARVs and those things, and they are producing drugs and selling to our young ones. So I want to know the permit of these people. What is the arrangement? Are they allowed to trade also and open up markets to do whatever they want? Or what is the stand of our country in this? Because yesterday we were talking about street kids, today is the issue of this foreign nationals trading spaza shops all over Namibia. So what is our stand? Are they allowed to trade? Or what is the arrangement? And how can we deal with these people? Because they are mass roaming everywhere. So I submit to the Speaker.
Okay, Honorable Minister. Honorable Minister Ipumbu.
Thank you very much, Honorable Deputy Speaker and Honorable Somai, for the question. The question is very general because it talks to foreign nationals. Foreign nationals are in categories. Foreign nationals are in categories, and you made reference to the category of refugees, and there are other categories also. They have various different permits. Those that are refugees belongs to the Osire camp. And of late, if you have noticed, we were doing the verification because we are also aware that some of them that's supposed to be in Osire find themselves in places that are not designated for them to be. That verification process was concluded end of May. but we have also since noticed that it did not include everyone. So it's being extended. We will give another week or two for more verification of those that belongs to the category of refugees. Now there is a category of those that come here with work permits that are coming to work for various companies who are authorized to be here. And then we have a category of those that are illegally here, who are classified as illegal immigrants. And those illegal immigrants, if you spot any of them, all of us as nationals or non-nationals, it's our duty and responsibility together with the law enforcement officers and the immigration officers to notify the relevant authorities. That's the Namibian police and the immigration officers, so that they are deported back to their country of origin, or sometimes they end up being locked up, depending on the magnitude of the transgression. Though there are some that are illegally here, they definitely do not belong here, and a tip-off to any of these authorities and officers is an urgent requirement from any of us, so that the corrective measures are taken. In the second category of those that are here to work, there is also elements of those that come here have authorized documents, but they end up doing not what is contained in their documents. It's also necessary for us to be informed so that we verify with the documents that they have if they are contravening the reasons why they are here, or they are still within the parameters of why they are here. In terms of trading, I wouldn't want to go in a domain that does not belong to me. I don't know who is authorized to trade. That, I think, belongs to the Ministry of Trade. And I would advise that that question be posed to the relevant ministry. Thank you.
Thank you. I think we have to. Honorable Amupanda.
Thank you, Deputy Minister. Deputy Speaker, I have an urgent oral to the Minister of Mines, Industry, Mines and Energy. Am I correct, Deputy Speaker? That's the correct title.
Yeah, not the one you read the other day in the paper. You know also. You
I
don't
didn't
need
say
to.
anything.
Yeah, that's why you're asking me, am I correct?
Yeah. So, Minister, usually we want procedural matters to... Is it me? Oh, okay. So we usually want procedural matters to be left to procedures and things like that. Now, there is a matter that is before you for determination, and that is the Nasan matter that has been appealed to you in terms of the relevant legal provisions of that. And between you determining that, making that determination on the basis of the appeal and the initial decision, a lot of activity happened in between. Two activities primarily. One, we now have this Vitol matter, the story of another day, and then we will now have this lack of fuel, pay in advance, and all these things that are basically all emanating from this decision of the Competition Commission. Now, it basically means that it's you now, Minister, who's going to be able to solve this matter. Are you consulting widely? Because that determination is not forever. That decision, the time would also lapse in which an appeal must be determined. Are you consulting properly? And I know Deputy Prime Minister Shifeta was, former Minister Shifeta was dealing with the phosphate matter. Are you consulting widely so that you are also able to, because sometimes we must also keep with one another. It's not an easy thing to determine. So are you consulting widely before you make a determination, or you are just going to make a determination on your own? Yeah, so we just want to, because there can be chaos depending on how you handle this matter. And I just want to see that determination and assurance that you are handling it, consulting widely and making sure the decision that is made would be in the interest of society, of the country, and stability, as we say.
Thank you, Honorable Minister.
Thank you very much, Honorable Mpanda, for the question, because clarity is needed. Yes, of course, there is an appeal against the determination made by the Competition Commission, which appeal I have received. Where we are now is waiting for thorough consultation. In the process, we have received some views already, and I have 4 months actually after the closure of the process of gazetting the appeal. So it is now this time that I'm busy investigating all the submissions made, going through so that I make an informed decision at the end of the day, which will then become the final determination. It all depends on different players, but I can guarantee the House that whatever decision will be taken will be the one that is in the best interest of this country. That is what I will go for, Honorable. Thank you very much.
Thank you. Yeah. I had Honorable April.
Thank you, Deputy Speaker. I am actually talking on to...
You are standing on point, you must guide me.
I said point of privilege, my senior, about what happened yesterday that resulted in the automatic adjournment of this House. Because I believe it's becoming a tendency in this House that we should normalize the abnormal. Respect is a basic fundamental character trait and cannot be afforded or given only when circumstances or conditions are okay in a relationship. This House, without me, Solomon April, carries its own decorum. Even if I'm not here, this House will continue to have the decorum because the decorum is vested in this House by the Namibian people. For us to bring laws for proper governance up there. Now, I don't want to point fingers at this point in time. I want to talk to all of us, myself included, by saying, if you look at Rule 61, 62, read together of 72 and 73, all of us will see there what is it that is expected from us in the manner that we are supposed to conduct ourselves in this House. What transpired yesterday was a bit extreme because I cannot demand respect without affording a modicum of decorum to the next person. We cannot continue to do business in
Honorable April.
So therefore, my Speaker, I want to call upon all of us to use the rules if we feel that we are being infringed upon when we contribute. Because no House, Deputy Speaker, no House will continue to stand on its own.
Okay.
No House, I'm finishing my leader.
But you see,
okay.
You see, you are standing on a point of order, isn't it?
Privilege.
Privilege, but you are
There's nobody for order here.
No, but you are making a statement, isn't it? Point of privilege is to bring something to the attention of the presiding officer. And if we so wish about yesterday, I think the ruling was there. We can revisit the ruling of what has transpired. That decision was taken, and we were all here. And therefore, if that ruling is not, we can go to standing rules or any member in terms of the rules of the Act of Parliament, the Privileges and Immunities Act, can bring that matter to the attention of the Privileges Committee. I think that's what the Act says. Now, to reintroduce it here will make a Pandora box, because your statement will be rebuffed by somebody else. And that's not a platform for us here. What has happened, and there are procedures and avenues that we can take stock of.
Yeah. Thank you for your...
It's not about chats. It's not about chats.
Yeah.
Thank you for your...
If you stand up and talk,
Deputy Speaker,
is having a problem.
Deputy Speaker, thank you for your wise counsel.
Okay.
Thank you so much.
Thank you very much. We make progress now. On that one, I allowed Honorable April point of privilege. No, I don't allow point of privilege. Just sit. Honorable Elder, just sit. Honorable Thomas. No, Honorable Thomas, sit. No, Honorable Thomas, please. Okay, Honorable Thomas, just sit down. Okay, Honorable Thomas, sit down. I'm talking to Honorable Thomas. I will come to him. I'm seeing this one. Honorable, please sit down. Honorable members, Honorable April requested the floor on point of privilege. I have allowed him. Ordinarily, I don't want to interrupt a member. But when I see there was sufficient time, I've given direction. And I'm saying point of privilege is not a demand for point of privilege. It's a request. And I'm not going to give requests for privileges, because there is nothing that is sinister or unprocedural at this point in time. So let's continue with the agenda, and then we can. Where I am wrong, you will guide me there, that in terms of this procedure, you are wrong here. Honorable Minister, Honorable Wise, please. No, Honorable Wise. Honorable Wise, please. Honorable Wise, please. No, Honorable Wise, please. Before the House goes into a direction in which you don't want to be part of, please just grant me that. No, please, Honorable Wise, Honorable Wise, Honorable Wise, Honorable Wise, Honorable Wise. I have ruled on the subject matter. No, I said I'm not. Please sit down, Honorable Wise. Please sit down. No, please sit down. Please sit down. Please sit down, Honorable Minister. Honorable Wise, you please sit down. Sit down, Honorable Wise. Honorable Wise, I will. Allow. Honorable Wise, if there are issues, if there are issues, as an individual, please deal it outside. I have said the member of point of privilege has stood up, and I have intervened and give direction. No, you must just withdraw. Just withdraw. What you are apologizing? What are you apologizing? What are you apologizing? Just withdraw and we go. No, you see, honorable members. Okay. Just sit down. You see, Honorable members, I'm always saying, what you are doing is, what you are doing, now you are laughing, here the camera, you are serious, you are doing what? We are given work to do. I don't know what you want. If you want to create this a circus, don't use me. I have given direction. If you are not in line with the direction, you excuse yourself or you sit and we continue. Yeah. Yes. Yeah, withdraw, my brother.
Honorable Speaker, I submitted that we can all be chaotic. If the situation called for that, I withdrew.
Thank you. Okay. Thank you. Okay. Yeah, just wait, Honorable Mkwanda. Just wait. Honorable Kandrodu, I did not hear, but is it correct what the member is saying? No, I'm asking Honorable Kandrodu, I'm addressing you. You don't know? Okay, let's make progress. But, okay. No, if that is, yes, wait, just, if the house is in this mood, I cannot, and I fail to handle discipline, I'm left with no other option. And I don't want to go to that option. You see, Honorable April, just sit down. You see, Honorable,
the system that need to record in my the system that need to record and say my partner.
I will, the table office advice. Okay, the table office advice, at break time, I will go and visit the answered. And then, just wait. I will go and visit the answered, and I will come back with a ruling after the answered. Yeah, I will go and visit the answered. That mic was on. You see? So let's not have that. I will go and visit the answered and come back. At break, I will go, table office advice. Then we'll go and listen, and then we'll come. Okay. Thank you. Yeah. Notices of question, motions. Nothing. Honorable No, I see Honorable Lukato is first.
Honorable Deputy Speaker, Member of Parliament. Today, Thursday, 25 June 2026, I hereby give notice that on Wednesday, 1st July 2026, I shall move that this August House discuss and agrees to table the motion to establishment of compulsory national medical aid contribution scheme to private medical aid coverage for all employed and unemployed Namibians who are currently not covered by medical aid fund. I so submit, Deputy Speaker.
Okay, table the motion. Honorable Cooper. Honorable Cooper.
Honorable Deputy Speaker, I move without notice in terms of Rule 124H, read together with Rule 76(1)D of the Standing Rules, Orders and Internal Arrangements of the National Assembly, that leave of absence be granted to Honorable Dr. Sarah Kuongelwa Madila, Honorable Dr. Elia Kurare, and Honorable Dino Palotti for 25th June 2026, while on official business. I further move without notice in terms of Rule 124H, read together with Rule 76(1)B of the Standing Rules, Orders and Internal Arrangements of the National Assembly, that leave of absence be granted to Honorable Derek Claassen from 30 June to 2 July 2026 due to the death of his close family member. I so move, Honorable Speaker.
Yeah, please table the...
It's in the rules.
Honorable Angula.
Honorable Deputy Speaker, I hereby give notice that leave of absence be granted to Honorable George Dipwamba Kambala for 25 June 2026 in terms of Rule 124H read with Rule 76(1)D of the Standing Rules and Orders. I so submit.
Yes.
Yeah, please table. Ministerial statement. Reports of the Committee of the Whole House and Conceptual Proceedings. Orders of the day. Today is question time. We'll go now to the Green Book. And the first question is question number 143, if I have the right book. Huh? Okay, it's a question by Honorable Yemba. Does the Honorable Member pose the question? Honorable Yemba.
Yes, I put the question.
Thank you very much. Honorable Minister.
Honorable Speaker, I will look for the response. I don't have it now. I'm not sure if I have it, but let me check.
Okay, so you will come back. Okay. It stands over, she's just consulting a book. Question 146 is Honorable Lukato to the Minister of Urban and Rural. Deputy, 146.
Defer.
That number 46, 146, I stand to ask the indulgence of the House to defer this question until next week.
Okay. Question number 152 by Honorable Klute to the Minister of Internal Relations. Does Honorable Klute put the question?
Deferred.
Oh, deferred?
Yeah, deferred.
Okay. The next one is Honorable, 159, again by Honorable Klute to the Minister of International Relations. Can I get an indication from Honorable Klute?
Deferred.
Deferred. The old strategy. Question 165, Honorable Klute. Just for the record, it must be deferred. If it's to be deferred. Yes, Honorable Member. Chief Whip.
To be deferred.
Thank you. Question 167, Honorable Ipumbu. Ipumbu Shimi. Huh? Oh, Ipumbu Nye. I just know this one is a priest. Sorry. Honorable. Yeah, now we must write Galimbo, man. Honorable Ipumbu. Oh.
This question can also, that one also stands deferred.
Okay,
Honorable
thank you.
Speaker.
Then the next question is question 170 by Honorable Ampanda to the Minister of Works. Does the Honorable Ampanda pose the question?
Deputy Speaker, just with your guidance, I see there was 2 weeks ago there were new guidelines that were published, and the question was based on previous guidelines, and the minister repealed the guidelines on which my question was based on. So I'm not sure whether the minister still want to answer based on the...
No, but you can also withdraw the question.
Yes, that's what I wanted to ask with your indulgence.
But now you are making the...
It becomes academic anyway.
Oh, now it's academic. Minister, do you agree it's academic? Since you are... As we are not from school, we just hear academic. Okay, I think the question, the events surpasses themselves, so the question is withdrawn by the member. Question 174 by Honorable Lutohesi to the Minister of Gender. None, the Minister and the Deputy is not present, so the question is deferred. Huh? No, the question 175 by Honorable Sisuku to the Minister of Health. Does Honorable Susiku pose the question?
Yes, I pose the question.
Thank you, Honorable Minister.
Mr. Speaker, question number 1. Mobile clinics are established strategically to address the unique challenges of providing healthcare in remote as well as in undeserved areas. These areas often lack the population density or infrastructure to justify the construction of permanent health facilities. Mobile clinics then serve as a crucial bridge, particularly considering the fact that we are aware of Namibia's, the way in which some areas are quite sparsely populated, and therefore mobile clinics serve as that bridge, bringing essential healthcare to communities that would otherwise have limited or no access, particularly in the process where we have not yet constructed an actual clinic or healthcare center. While it is true that mobile clinics are not automatically transitioned into fully fledged clinics, this is of course by design. The approach is strategically to assess the long-term needs of each community. So ultimately what we do is we consider factors such as the population growth, disease prevalence, as well as evolving healthcare needs of the population. At this particular point in time, we have multiple requests that have been sent to my office for construction of clinics in various areas. And so at that point in time, an assessment is thus made on the long-term needs of the community, the growth in that particular community, and then assessed as to whether a clinic is needed full-time and where it would fall within that particular calendar in terms of the requirements according to population needs. The outreach services at these sites, which did not have any structure in the past, now allow for healthcare to be provided. However, it is true that in some instances, it has been rather difficult to provide comprehensive services with dignity due to factors such as lack of privacy, no proper infrastructure at some outreach points. The Ministry of Health and Social Services therefore started with the construction of these basic structures at the outreach sites to ensure the provision of proper services as required. The mobile clinics the Honourable Member referred to are therefore the basic structures that have been constructed at those outreach points. Kwena, Nakabolelwa, and Makanga are therefore part of the 65 basic primary healthcare structures constructed at the outreach sites countrywide to enhance service provision at the community level. The Ministry of Health and Social Services is also currently busy with what has been widely known as community health posts, a Class E tier of services that are provided at a lower level than a clinic, which sometimes community members might confuse that it was supposed to be a clinic, but it doesn't meet those services because these are community health posts and not designated clinics. The Ministry officially launched the concept of community health posts in 2024 during the official opening of Orutumba Community Health Post in the Opuo district in the Kunene region. Question number 2, Honourable Speaker, Honourable Member. Our long-term plan is centred on a phased approach that strengthens community health care and ensures sustainable access to services. The structures are therefore gradually being transformed, firstly into community health posts. We are rolling out the concepts of community health posts, which represents a critical step in strengthening primary health care at the grassroots levels, also because we are well aware that a majority of the time, quite a large bulk of the patients we see at more of the further facilities are green cases which ultimately could be managed at that level. The aim is not to necessarily convert the community health posts into primary health care clinics when the criteria for the clinic or for a clinic is not met. So the Ministry has certain criteria that must be met for clinic construction, such as population size, distances from other healthcare facilities. However, they will not remain community health posts and perhaps provide the services through outreach-based services on the scheduled development by respective district will also combine to ensure that the necessary services are provided. In the future, when criteria are met, certain community health posts may be then upgraded to clinics. The Ministry of Health and Social Services conducted a national sensitization or regional. I will leave that out very briefly, Honourable Deputy Speaker, Honourable Members. Question number 3, the transition of mobile clinics to fully fledged clinics is not an automatic process, as we have explained. However, we have made progress, significant progress in upgrading facilities and strengthening community-based care. So, in places where there are no services at all, the role then and the goal is to provide at least outreach services. In places where possible and needs do require, we then set up community health posts. Where we do the assessment and a clinic is needed, we then place them on the calendar for the construction of clinics. However, as mentioned, cognizant of the fact that there is quite a long list of areas currently demanding clinics. And so because of the number that is needed and the cost associated, that is why the Ministry, instead of denying healthcare services, then says, let us at least provide outreach services in the interim. Question number 4, Honourable Deputy Speaker. The Ministry does not have a fixed timeline with converting the mobile clinics into fully fledged clinics, as mentioned, because this depends on several factors, such as community density, catchment area size, as well as, which is most critical, the availability of resources. Now, with the decentralization that the ministry undertook in 2025, in November, it now allows some of these basic functions to be done at regional level, including the overseeing and construction of clinics and health posts, community health posts. It then becomes an issue of resources. Question number 5, Honorable Deputy Speaker. Provision of services at mobile clinics or community health posts is monitored and documented in the existing District Health Information System, known as DHIS2. The Ministry is aware, through the review of data from this electronic system, that some districts have not been able to visit all of their mobile clinics or community health posts because of transport challenges. The Ministry is thus currently working on a more feasible and sustainable long-term approach in terms of sustainability regarding transportation and vehicles across the country. Provision has been partially made in this financial year, and the plan is over NDP 6 to ensure that those needs are met, and strategically that a maintenance plan is put in place so that we're not caught unaware and reactive, but we ensure that going forward we have the necessary transportation available. Question number 6, Honorable Deputy Speaker. Yes, and such mechanisms include the deployment of trained community health workers to manage health posts. The Ministry currently has over 1,000 community health workers. The goal that was given by my office to the Directorate of Primary Health Care in 2025 was for just over 6,000 community health workers in these 5 years. That was made on the calculation of how many community health workers are needed per catchment area and per Namibian, according to the World Health Organization. Regular visits by district health teams to provide supervision and support. There is also monthly data reporting systems to track service delivery and community involvement in identifying needs and providing feedback, which ensures services remain relevant and effective. Honorable Deputy Speaker, question number 7. As I have stated, the Ministry approves mobile clinics primarily to bring healthcare services closer to communities. They provide a standard package of essential primary healthcare services. This ranges from health education, immunization, family planning, prevention of communicable as well as non-communicable diseases, and provides for the treatment of minor ailments. While they may not offer the full range of services available at clinics, health centers, and hospitals, they are designed to ensure that communities still have access to basic life-saving care with the necessary referral pathways in place for more complex conditions. Honorable Speaker, Honorable Member, in conclusion, the Ministry remains steadfast in the commitment to ensuring that the Namibian people have access to basic healthcare services. This requires a more strategic approach as opposed to a reactive approach where an ambulance is provided because a community member complains or because a clinic is provided because there are complaints. So the Ministry is currently in that strategic phase of mapping out what that would look like. Because of resources, we might not be able to build all the clinics we need at once, but there is currently a plan that is in place to ensure that it is a phased approach. Thank you.
Okay, thank you. Now we shall break for 20 minutes and then come back, and then we continue with from question 177. Okay. Ampanda. Honorable Ampanda, on a point. Honorable Ampanda.
Yeah, Honorable Speaker, while ministers are coming, I just want to say there has been an improvement on the minutes. We want to thank the Secretariat and presiding officers for the good work. So when we criticize you, also when you do well, we will be here to say there's a good improvement. Let's continue.
Okay, thank you, Honorable Sisiku.
Thank you very much, Honorable Deputy Speaker. I have a follow-up question to the Honorable Minister of Health. I heard she was talking about the distance and also the population. So I just wanted to find out how much distance is it required for them to establish or to give that a clinic? And then secondly, what is the population required?
Okay, Minister.
Honourable Speaker. So, Honourable Member, we intentionally didn't give those figures. As you would note in the response, we kept saying it depends on various factors, such as distance, population, and others. We are very cautious to give a predetermined value, because then that means that we are obliged to put clinics in those places if the distance is met, but perhaps the population factors are not met. So what we do is a holistic assessment, whereby we then assess everything together outside of just the population and the distance, including whether they are nearby facilities. For example, it might be a population of just 100 people, as a very random example, but because of the fact that there are no nearby clinics and health centers and hospitals, it would qualify for that. I hope that answers it. Thank you.
Thank you. Yeah, now that takes us to question 177. Honorable Lucato, do you pose the question?
Deputy Speaker.
Yes, repeat now.
Question.
Thank you very much. 177, Honorable Minister.
Thank you very much, Honorable Deputy Speaker, Honorable Members, and let me thank Honorable Lucato for the question. I would answer the question like this. One, that indeed it is not billions of dollars that were given as a grant to the NORAD bodies, but it was indeed around 144 million, to be precise, 7.5 million euros in a grant. That is to answer to, just to clarify that it was not billions, as I've seen in the question. Now, this funding was not only for the region of Zambezi, although Zambezi is also included. It's actually within the NORAD regions. The financing agreement was concluded in 2024 already, and then contractors were already awarded in 2025 in October to start the work to implement the actual project. And work has been advancing. Projects, most of them are completed. For example, in the Zambezi region, specifically in Katima Mulilo, 2 areas were prioritized, and these are Choto Extension 7 and Choto Extension 8. And together, these areas are expected to have connected 700 households roughly 313 extension 7 and 365 in extension 8. So I would also want to add information that implementation was also coordinated for electrification across other North regions such as Kavango East, Kavango West, Ohangwena region, and Oshana. So all these activities, rural electrification, peri-urban electrification, has been ongoing indeed. I'm planning also to do an oversight visit specifically to the Zambezi region in the next few days. So this also includes mini-grid developments under this grant for Komsati and Kunene region. So they are done. For us, is maybe to make some oversight visit just to see how they are functioning and how people are appreciating. But I'm sure they should be appreciating by now. It is part of government's broader strategy to achieve universal electricity access by 2030. And through service level agreements with regional electricity distributors and collaboration with NAM Power, the government is expanding electrification to households, schools, clinics, and the public institutions. But of course, also the general public, as we also extend to general households in villages across the country. So the 144 million, which is the grant, is not the final solution to rural electrification though, but it is a meaningful step which we appreciate. When used strategically, it has actually helped us to achieve part of our goals, which is to provide electrification or electricity to the public, to institutions, especially schools, hospitals, clinics, and so on. Honorable Deputy Speaker, the question was very straight, very short, to the point, and so is my answer. Thank you very much.
Thank you. Honorable Lucato.
Yeah. Honorable Deputy Speaker, Honorable relative brother Minister, let me commend you for the good response and very much appreciate. And also I just want to add that it's not only Zambezi, according to my question, all over the countries where I've been affected. I thank you so much, my God.
Thank you very much. Okay. That takes us to question 178 by Honorable Mouton. Yeah, no, the minister is not here. That takes us now to question 180 by Honorable Brinkman to the Minister of Health. Does the Honorable Member put a question?
Yes, Speaker, I do.
Thank you, Honorable Minister.
Honorable Member. Thank you. Question number one. Question number one, clarification. I will not read the question. So, to answer the first question, clarification on the ambulance availability. It was reported that a pregnant mother and a sister lost their lives due to the unavailability of ambulance services when they were transported in a police van. While the loss of life is deeply regretted, the report largely suggests that no ambulances were available when in fact 3 ambulances responded to the mass accident, including 2 from the Ministry of Health and Social Services and 1 from the municipality. Immediate measures, as I previously reported to this August House, in May 2025, 36 ambulances were commissioned and distributed across the regions. In addition, 9 panel ambulances van ambulances will be deployed within the next 3 weeks. Now, this is at that particular point in time, and then I'll provide an update as to where we are now. The total of number of ambulances procured is what the resource or what was appropriated to the ministry and what could be afforded by the ministry during that financial year. As the Honourable Member would be aware, of course, that despite the fact that the ambulances are crucial and a very top priority for the ministry, it is also an issue of resources, where resources that are appropriated must be utilized to procure these ambulances. Regarding sustainable measures, a vehicle replacement plan is in progress. We are also strengthening our fleet management systems. This is to ensure that there's proper maintenance and repair. We have had a long-standing issue where we are being called and informed that Ministry of Health ambulances or an ambulance has been parked because of a tire, because of a window, because of things that can be easily fixed. What we have noted as a ministry is that we need a strategic plan, as I previously mentioned in my previous answer, regarding a strategic response to these items that is not reactive, but that is proactive. Hence why the ministry is currently busy. The team responsible for the fleet of the ministry is currently finalizing that strategic plan. In previous years, the ministry has had contracts or pre-qualified service providers in the regions that are then able to assist in terms of repairs of vehicles when they, for one reason or another, are not able to function. But the ministry has noted that despite this particular effort that is in place, it is not necessarily addressing the needs, particularly in the region. And so my office has then tasked the directorate to provide a more substantial reformed approach. In addition to having pre-qualified suppliers within the regions, how can we ensure that we carefully monitor these vehicles, these ambulances, to avoid them getting to a place where we have no ambulances because an ambulance has been sitting unutilized for months, sometimes years, and ministry officials are not even aware of it. And so this strategic plan is in place, and the rollout starts officially this year still. Current status in Mariental, I wish to clarify the current status of ambulances in the Mariental district. According to our records, the Mariental district has 9 ambulances on the master list. Of these, 5 are currently in running condition. 3 are stationed at the hospital, while the remaining 2 are at the periphery health centers, being Maltohoa Health Center and Meite Clinic in Cesarium. As of the day in question, the hospital had 3 ambulances in running condition. Thus, perhaps ambulances were not the direct issue when the matter was further investigated. Regarding improving staffing of shift management for ambulance drivers, which is a critical question, and I thank the Honourable Member for asking that question. Staffing and shift management are vital for the effective operation of our ambulance services. When drivers are tired, they are not able to function properly, it leads to accidents and others. And therefore, regarding staffing levels, the Ministry is aware of staffing challenges regarding the drivers in Mariental, particularly regarding emergency care practitioners and drivers. The hospital is operating with 5 out of 11 emergency care practitioner positions filled. The number of drivers is also a concern. The Mariental District Hospital has 4 driver positions. 3, which is 75% of the 4 posts, are filled, leaving only 1 vacancy. It is important to note the driver positions for outreach and periphery facilities are separate, with a total number of 9 drivers in the district, including those serving clinics such as Stamford and Ogahanas. Recruitment processes are underway to fill critical emergency care practitioners and driver positions, supported, of course, by budget allocations, which oftentimes is the greatest limitation. However, the needs have been provided, and the Ministry is currently doing a recruitment process for this financial year. A majority of the Ministry of Health's vacancies, some of them, went out in May, and some are yet to go out this month still. We've given the regions a deadline to fill these vacancies by August 2026. And of course, should more finances become available, perhaps at the midterm budget review, we will then make sure to provide the necessary practitioners, drivers, and emergency care practitioners to fill the necessary posts. Shift management, we are implementing standardized shift scheduling protocols that consider workload demands, staff availability, as well as I mentioned, the need for adequate rest periods, which we do take note must be prioritized. A real-time tracking system for ambulances as well as emergency care practitioner shifts is also being explored, and this is to improve shift management as well as resource allocation. So we only get a certain amount of resources, fine, but how can we maximize those resources with what we have to at least try and make sure we cater as far as possible to the communities concerned? Shift coverage clarification, the drivers work the 8 to 5 shifts, while the emergency care practitioners are scheduled to work 12-hour shifts to cover emergency response. This is a common practice, particularly for healthcare practitioners. As of the 1st of April 2025, the advanced emergency care technician assumed duty and has since been working on streamlining the emergency medical response services, hence the need to review streamlining these services. Honourable Deputy Speaker, question number 2, addressing misconceptions regarding the 5-month-old baby. Regarding the death of a 5-month-old child, it is worth noting that the senior medical officer of the hospital at this point in time stated that the hospital is not aware of a child with bowel obstruction diagnosis as indicated by the Honourable Member. There was, however, a child, a boy with the same age, admitted with acute gastroenteritis and severe dehydration, no malnutrition, on the 11th of September 2025. The prognosis of this child was discussed with the parents as the situation unfolded, so this death was not particularly related to a transport issue, but rather the child demised while the discussions for referrals were still not concluded, given or due to the severe condition of the child. Investigation and accountability, Honourable Member, Honourable Deputy Speaker. The Ministry launched an immediate investigation into the reported issues surrounding oxygen supply. Now, at this particular point, we noted that if mismanagement or negligence was found, action would be taken. Preliminary investigations at that time revealed that the oxygen plant at Marienthal State Hospital started to malfunction, prompting the hospital to increase its supply of oxygen cylinders as a contingency. After this question was asked in the report and the answer was then prepared, conclusions were made about what was happening and how it was malfunctioning. The team was sent to the region and the matter was resolved. In conclusion, Honourable Deputy Speaker, Honourable Members, the Ministry of Health and Social Services is fully committed to addressing the challenges not only facing the Marienthal State Hospital, but of course improving healthcare services overall. This particular question made reference to transportation, particularly ambulances. For this financial year, the Ministry is currently due to officially, at the end of this month, we are receiving 2 ambulances, one which is due to go to Gum, and the second one which is due for Kariba. Then we have 19 ambulances, other ambulances, that fittings are currently being done. And as soon as those are finalized, fitting is due to be finalized in August. And as soon as that is done, we will then dispatch those to the regions. Outside of those 19 and 2, we then have another 11, of which the procurement process has started, after which fittings will then also commence, and those will then be dispatched as well into the regions. As mentioned, with additional resources, the Ministry will definitely procure more ambulances and dispatch more. Thank you.
Thank you very much. Honourable Brinkman.
Thank you, Deputy Speaker. Honourable Minister, thank you for that in-depth answer indeed. Just one question, point of clarity rather. The Honourable Minister said that at the scene of the accident, there were 3 ambulances. But we know that the mother was carried in a police van. Does it mean the ambulances were not available at that time, or the communication was not brought to the attention of the hospital, or what could be the reason? I don't know. How does the police get involved if the ambulance were available? I just want that clarity. Thank you.
Thank you. Yes, Honorable Minister.
Members, for the follow-up question, one of the key things we've noticed as a ministry is the need for an emergency, firstly, number one, to ensure that our emergency services operate from a national level, which is currently not happening. So oftentimes, there is quite a bit of a communication breakdown, which should not be occurring. The same way as when there is an MVA, automatically you should have a call center that you can immediately call, one universal number that then allows you to track which ambulances are available in the region, in the area, without having to make multiple phone calls, is what the ministry is now working strategically to implement. So to answer your question, yes, there definitely was a communication breakdown, and the ministry now sees that as an opportunity to fill that gap by ensuring that not only for Marienta, but entirely for the country, we work towards building a national emergency care, firstly, call center, but also manned from a national level, whereby we not only look at the issue of providing ambulances and the communication, but also ensuring that we have the necessary emergency care practitioners available for various regions. So to answer the question, yes, there was a communication breakdown, and we are working on it. Thank you.
Okay, thank you. That takes us to question 181 by Honorable Klute. Honorable Likando.
I defer the question.
Thank you. We must just do it for the record. Okay, then that question 182. The Minister is not in. Question 183. Minister is not in. 184. No, I scratch. Minister is not in. 185. 186. 187. 188. Honorable Yemba to the Minister of Home Affairs. Does Honorable Yemba pose the question?
Yes, we pose the question.
Okay. On behalf of Honorable Yemba, Honorable Minister.
For the question to stand over.
To stand over, okay. That takes us 189, Honorable Motu. No. Yes, repeat now. Yes.
Yes, Deputy Speaker, I pose the question.
Okay, Honorable Minister. No, you have, okay, thank you.
Thank you, Honorable Deputy Speaker. I rise to this afternoon to provide response to the question posed by Honorable Motu regarding the report of the Commission of Inquiry into claims of ancestral land rights and restitution. The government of the Republic of Namibia convened a second National Land Conference from 1 to 5 October 2018, resulting into several key resolutions, including the establishment of the Commission of Inquiry into the claim of ancestral land rights and restitution, yes, the late President Dr. Hage G. Geingob, may he so rest in peace, appointed the Commission to examine these claims as well as issues pertaining to restitution. Following the fulfillment of its mandate, the Commission submitted the recommendation for the implementation. Several recommendations put forward by the Commission of Inquiry into the claims of ancestral land rights and restitution have already been incorporated into existing policies and the legislation. Notably, the prohibition on the acquisition of agricultural land by the foreigner nationals was included in the land bill prior to the convening of the second National Land Conference. Additionally, the Commission advocated for the comprehensive review of the current land reform policies and programs to promote equitable access to land and safeguard land rights and tenure. These recommendations are now reflected into both the land bill and the reviewed National Resettlement Policy for 2023. The updated National Resettlement Policy 2023 has established 3 resettlement models designed to enhance focus allocation and foster productivity. These models include the high economic value model, moderate economic value model, and the low economic value model. Several recommendations from the Commission of Inquiry into the claims of ancestral land rights and restitution resuscitate the development of the new policy and the legislative framework. For instance, claims pertaining ancestral land are among these recommendations the Ministry continues to address. The Ministry is partnership with the Ministry of Finance, the Ministry of Agriculture, Fishery, Water and Land Reform, in partnership with the Ministry of Finance, established a ring-fenced fund separate from the Land Acquisition and Development Fund. This newly created fund facility the acquisition of land for the resettlement of generational farm workers and individuals occupying corridor areas. For this current financial year, the Ministry have been allocated the dedicated amount of 100 million Namibian dollars for this initiative. Honorable Deputy Speaker, the Commission of Inquiry on Ancestral Land Rights and Restitution was established by the President of the Republic of Namibia. Its report was submitted directly to the President, who serves as the appointing authority. The responsibility to disclose the finding of this report is to the relevant legislative body. It does not lie with us. I have been instructed to proceed with the implementation of the recommendation outlined by the Commission of the Inquiry into a claim of ancestral land rights and restitution. As previously mentioned, furthermore, during the State of National Address, Her Excellency President Tumbo Nandi Ndaitwa called for the finalization of the land bill and the development of the ancestral land right policy. The Ministry is preparing to share a progress report concerning the implementation of the resolution from the second National Land Conference with the public. To facilitate this process, the Ministry intends to conduct town hall meetings across the country to update and engage citizens accordingly. Thank you.
Honorable Motu.
Thank you very much, Deputy Speaker. Thank you very much, Deputy Minister, for your attempt to answer my question. I just want to know 3 things. Firstly, which law pertains that reports of commission should not come to Parliament as the House of Review? Can you please quote it for the House? Secondly, you're speaking on resettlement models. This suppress ancestral land rights. So you cannot say ancestral land rights are incorporated in the land bill if the commission itself is something separate. The resettlement is for affected communities, yes, but it doesn't stipulate ancestral land rights. That's why the Hoikom and Komani communities have been not been able to put their claims through the resettlement policy program over the years. So you can't mix up the two, Honorable Minister. Kindly clarify. And then lastly, you didn't speak on the benchmarks. What benchmarks have you put in place to see that these resolutions are being fast-tracked? What is the progress? And then thirdly, which communities have you identified to engage with? And can you please tell us as the House of Review? Thank you very much.
Yes, Honorable Minister.
Thank you, Honorable Moto, for the follow-up question. Your first question in terms of the loan, thank you very much, is yet to be established. I don't have it now. And then on the other one, on the model, this model, yes, they have been on the first one it was on the law, and then on the model, and then you are questioning the issue of the land bill. Yes, that's the current state that we can offer for now, because we have presented the land bill to the Parliament. Should it be that we endorse the land bill, all that shall be realized. And then on the benchmark, that will be, you are going to be informed. Let me establish this one, which area are we going to, or which state are we going to do the benchmarking. And then which community, we said is the whole country. I can't give you a specific region. I so submit, thank you.
Thank you very much. Now, I have seen the Minister of Environment. I just ask your indulgence. We've passed many of her questions. Maybe it's fair that we give her opportunity. Is it fine, honorable members? So we'll go back now. Okay. Help me, table office. Which first question is? What? Okay, it takes us to question 182. On 182 by Honorable Mvula to the Minister of Environment. Does Honorable Mvula move the question?
So move, Deputy Speaker.
Thank you, Honorable Minister of Environment. Maybe just earlier the Minister also we said question 1. Okay, let the Minister come out of Home Affairs. We'll also have to stand over. Ne? I'm just checking the number. 143 is also standing over.
You are. My time.
Okay.
Thank you, Honorable Deputy Speaker. Thank you, Honorable Members, for the opportunity. I rise to address this August House on the question related to June 7, raised by Honorable Enias Mvula. Yeah, I think due to time, I think event has happened. As I speak now, this concession is suspended because the duration it took to take off the ground. But if I can highlight on how it was issued, the ministry followed due process of nature conservation ordinance and public procurement framework. The tender process was widely advertised, competitive, transparent, with evaluation conducted strictly in line with the established criteria. The concession was first advertised in 8th of August 2022. 39 companies and individuals registered for that, but only 2 submitted proposal, both which failed evaluation. The ministry therefore re-advertised it again, and a concession on the 16th November 2022, and then 2022 through various, again, national newspapers, the ministry's website, tourism platforms, such as Hospitality Association and others, and 28 companies and individuals registered, of which 99 attended the compulsory site visit, and 3 bidders submitted proposals by the closing date of 27 January 2023. Following the evaluation, maybe I should just go straight to the questions. Is the minister prepared to share with the public the type of concession awarded to June 7? Yes, we are prepared, and I am prepared. There is nothing secret about the June 7 concession, nor any other concession awarded by the ministry, which is also secret. A list of all awarded concessions are available and for download also from the ministry's website. The concession awarded is developmental, including the construction of salads, a restaurant, as well as activities such as camel rides, amongst others. These rights were clearly stipulated in Honorable Mvula's notice of question in itself. Question 2, the granting of concession of Namibia by MEFT and previous other authority dates back over several decades. How many concessions exist and how many will have expired by the end of 2024-2025 financial year? There are, currently as we speak, there are 48 active concessions awarded, of which 5 concession contracts expired in November 2025. And what economic opportunity has June 7 concession created for the community of Walvis Bay from March 2023 to March 2025? June 7 concession contract was signed on the 14th of March 2023. The concession involves development of infrastructure. Like all other contracts, it allows for 2 years period during which the successful bidder must acquire all relevant authorization and permission before commencing with construction. This includes the environmental clearance certificate, which has already been issued for the concessionaire after conducting an environmental assessment, impact assessment. The concession is situated in the sensitive environment, and the ministry is aware that the operator must consider other factors before development. Nevertheless, the concession will create economic and job opportunity and spin-off for the community of Walvis Bay. Jobs were expected, I will speak now because events have taken over. Jobs are expected to be created by the onset of construction, when you need people, when you are constructing, or employees, when you, employee when you are constructing, requiring both skilled and unskilled labor. It is anticipated that approximately 49 people will be employed compared to the current status. The concessionaire has further committed to other social initiatives and projects once concession is operational. The last question, can the Honourable Minister make the contractual agreement between the Ministry and the concessionaire public knowledge? The contract between the concessionaire and the Ministry is governed by the law of the Republic of Namibia. Either party is bound to keep confidential any information acquiring in relation to contract, unless disclosure is required by court order or to comply with any law or government regulation. I can confirm that the information on rights awarded and the duration of the contract is accurate, as reflected by Honourable Mvula's notice. Comprehensive advertisement containing the rights and the duration of the concession were placed in 3 newspapers, as reflected in the introductory part of the response. Therefore, there is no secrecy around any of the concession awarded, and if reasonable information contained in the contract is needed, the Ministry can make such known through the right procedure. Honorable Speaker, honorable members, I believe I have comprehensively responded to the Honorable Mbula's question as it was posed and as it was appropriately needed. I so submit.
Thank you. The follow-up, Honorable Mbula.
Yes, Honorable Deputy Speaker, just very, very short. First of all, thank you, Honorable Minister, for a very precise, well-crafted feedback. I'm actually glad that, you know, this thing has been addressed. Honorable Minister, you would also agree with me that there is a necessity for your ministry liaison desk, if it doesn't exist, to exist, so that you know, complaints can easily be actually transmitted or communicated to your ministry, because this concession thing, the concessionaires and the concessionaires and what they commit as deliverables for the good of those communities and what happens on the ground. In reality, they actually, there is no synchronization. So I'm sure the Honorable Minister would agree with me that such a desk will be very valuable. Thank you.
Honorable Minister.
Thank you, Honorable Mbula, for the comment and advice. Yes, we do take note, but as you know, the Ministry of Environment, Forestry and Tourism has got footsteps all over the country. Yes, we do have offices, and those officers are expected to address and to help community members when they work in our offices with concerns, even if the concern does not involve that specific officer. It must, there is always a way to channel the question to the right people. But your advice is taken. Maybe you will, at the head office, see what we can establish, somebody who will hands-on on these questions. Thank you.
Thank you. It was question 183. Yeah, we are going now to question 183, Honorable Likando.
I put the question.
Thank you, Honorable Minister. Question 183.
Thank you once again, Honorable Deputy Speaker, honorable members. I rise again to respond to the question raised by Honorable Likando regarding the issue of danger allowance for staff within the Ministry of Environment, Forestry and Tourism. The duties and responsibility of our staff are diverse and often hazardous, and that we fully agree with you. They include attending incidents of human-wildlife conflict, undertaking anti-poaching operations, enforcing conservation laws, conducting game capture, handling snails, carrying out operation in water courses, and maintaining parks infrastructure, and among others. That is just to mention some. These tasks, indeed, expose our officials to significant risks in the course of protecting and managing Namibia's natural resources. In recognition of these challenges, the Ministry submitted a request to Public Service Commission in 2022, it's not something new, for the consideration of danger allowance of our staff members. We have since been in consultation with the Commission, and based on our inquiries, we are informed that the matter is under still review and the Commission is expected to provide recommendation on the office. Just like I want to say, it's a very diverse, and one has to weigh and to look at, because it's not just a general and a bracket one, it has to look, because we have different teams as well. And the level of dangers is also different. On the question now, specific question, question 1, will the Honourable Minister confirm whether game rangers and game guards employed by the Ministry of Environment, Forestry and Tourism receive a danger allowance similar to the allowance granted by the Ministry of Agriculture, Fishery, Water and Land Reform? The answer is no. Currently, staff members of the Ministry of Environment, Forestry and Tourism do not receive danger allowance. Question 2, if so, will the Minister indicate the exact percentage of basic salary and constitute the allowance for each category? Based on my previous response, this question is not applicable. The date in which the current rate was approved and last revised, the same with this question is also not applicable. And then answer, as mentioned, because of that there is no danger allowance, this question becomes irrelevant to the previous answer. So we move to question number 3. If no such allowance exists, will the Honourable Minister explain why MEFT rangers are not afforded the same recognition as fisheries inspector and observers despite facing comparable or greater occupational risks? The Ministry of Environment, Forestry and Tourism acknowledges that its officials are frequently confronted with various risks and hazards in the execution of their duties, particularly in the protection and management of our natural resources. Despite the absence of danger allowance, at present, the Ministry recognizes the importance of adequate safeguarding and compensation staff members who operate under such challenging conditions. As indicated in my introductory remarks, we have since been informed that the Commission is currently reviewing our submission with the intention of providing its recommendation to the Office of the Prime Minister. The Ministry awaits this guidance and remains committed to ensuring that the welfare and the safety of our staff members are appropriately recognized and addressed in line with the government policy. Question 4, what category of MEST staff currently qualify for such allowance? Namely, permanent rangers, contract rangers, conservancy game guards, specialized anti-poaching units. The answer is our request to Public Service Commission is for staff members who deal with anti-poaching, law enforcement, human-wildlife conflict, snake catchers, park maintenance, and those involved in water operations. Question 5, beyond allowances, does the Ministry provide additional protection for rangers, such as medical evaluation, assistance, or adequate protective equipment and specialized training? The government has made provision for comprehensive public service employee medical aid scheme, which, in other words, SEMAS, under which all staff members, regardless of positions, qualify for medical aid. In cases of injury on duty, all employees contribute to Social Security, entitling them to benefit under the Employee Compensation Fund. Through this fund, the Social Security Commission may compensate affected employees and cover medical costs, provided the case meets the requirements set out in the fund's rules. The ministry, through its wellness office, facilitates referral for psychosocial support by engaging staff members and obtaining their consent as well. They don't force staff members. Once agreed, affected employees are referred to specialized care with cost covered by SEMAS. Additionally, the ministry provides essential field equipment such as tents, mattresses, cutlery, crockery, chairs, reflector jackets, and raincoat, among others. As part of implementing the revised national strategy on wildlife crime and law enforcement of 2018 and 2027, the ministry offers 2 short in-house training courses for relevant staff. One is the basic rangers training and the law enforcement training. These courses are delivered by senior specialists within the ministry as well as international subject matter experts. They aim to equip staff members with critical skills and knowledge in areas including the Nature Conservation Ordinance, the Criminal Procedure Act, and a code of conduct, animal behavior, and weapon handling. The last question is question 6. If the ministry cannot provide this allowance, what alternative measures will immediately be in place to protect rangers in the line of duty? The answer to this, the ministry remains committed and stands ready to roll out danger allowance, and authorization has, once authorization has been granted by the competent officers. Honourable Deputy Speakers, honourable members, I trust that this clarify and answer the questions raised by Honourable Likando. I so submit and I thank you.
Thank you. The follow-up. Thank you, Honourable Likando.
Thank you, Honourable Minister, for your detailed reply. I just want to find out, because you spoke about that the ministry made some recommendations to the Public Service Commission. When were these recommendations made to the Public Service Commission? And also maybe just to find out whether the union that is representing these workers is made aware of the recommendations that were handed to the Public Service Commission. Thank you very much.
Thank you. Minister.
I think in my response I have indicated the date. It was initially submitted in 2022, and I think continuously we are making follow-ups, and the latest one, I cannot recall, I don't have all those details, but I know last year again there was also a follow-up. I mean, it's not also something that we are taking for granted. As a ministry, we have already made our commitment that yes, there is indeed a need for danger allowance for our staff members, because I think we are also in the best position to advise the Public Service Commission in terms of the operation and the danger thereof. I so submit.
Thank you. I now go to question 184, but maybe if you want to rest, we can take 186 and come back to you. If you are ready, you have the floor. Are you ready? Do you put the question, Honorable? Can I skip you and go to agriculture and come back? Come again? Are you ready? I can give you. Or defer that one. Okay. Okay. Thank you. No, don't be a security. You are an honorable member. Don't demote yourself to be a security now. Yeah, check on the green paper. Leave the movement. Honorable, we now go to your polls. 186, ne? 184 is deferred, isn't it? Yeah, but 186 stand over. So now the minister is here, the member is here. Do you put the question, honorable member?
Deputy Speaker, I pose question.
Thank you. 186. You can defer it, my minister. This is. Honorable Inge.
Okay. I seem not to have that one, so let's just defer it. I thought my DM had also answered.
Yeah, she answered one.
Oh, 189.
Yeah, 189. That one.
Let me come back while I'm sorting my papers.
Okay. So that will take us now to. I went back. Help me, table office. 191. Okay. Question 191 by Honorable Lukato to the Minister of Home Affairs. Okay, 191 is deferred. Question 192.
192, but it was overtaken by.
Yeah, but the minister communicated. If the minister defers, do you put the question?
I pose question, Deputy Speaker.
Honorable Minister.
192.
Not 192, 191.
Your mic.
Honorable Ipumbu, Lucia.
Yes, Honorable Deputy Speaker. I defer the question.
Okay. 191 is deferred. 192, Honorable Lukato to the Minister of Health. Honorable Lukato. Yes? It must be read so that you can. Yeah, yes.
So, Deputy Honorable Speaker, I pose question to the Honorable Minister.
Okay. Honorable Minister of Health. I don't want to say what Job said, but yeah.
Thank you, Honourable Member. I would like to think that this question was overtaken by events as well, but since the question has been put, I will proceed to still answer. Honourable Speaker, I thank the Honourable Member for raising this important matter. The Ministry takes note of the fact that, yes, uniforms are a critical part of professionalism and uniformity. We have received multiple complaints over the years whereby staff members are unidentifiable. Sometimes patients want to raise complaints, but they're not able to identify who treated them. And that becomes problematic. And because of this, as well as so many other factors, the Ministry then took the decision last year, 2025, to start a procurement process, and over 15,000 healthcare workers received uniforms. Is that sufficient? Absolutely not, but it is an absolutely fantastic start. And so yes, the Ministry recognizes that uniforms are important, and we will continue. That was phase 1, and we look forward to phase 2 in order to ensure that all healthcare workers can serve the country in dignity. Thank you.
Thank you. Is there a follow-up, Honorable Likato?
Let me say, my relative sister, Honorable, thank you for your response.
Thank you. That question 193. Question 193. Honorable Thomas.
I pose question, Honorable Chair.
You put the question or you pose the question?
I pose.
Okay.
Yeah, we pose question, we want the answer.
Yeah, no, that is the elder language. Honorable Minister?
We are posing.
Thank you, Honorable Deputy Speaker, honorable members. I rise to respond to the questions that have been asked by Honorable Bishop Thomas of BCP in the order that I'm going to read hereafter. Honorable Minister, are you aware of this removal of the recognized headman and replaced by the unrecognized? If I just answer you...
No, Honorable Evelyn, just do what you have to do.
Kandorozu, you have been sitting quiet
Honorable.
while you are provoking me. I'm coming in peace, please. Don't provoke me. Okay, I will just go straight to the answers on your demand. I'm not privy to these issues as it was not reported to my office. The Traditional Authorities Act of 2000 provides for designation and removal of traditional leaders and traditional council members by the traditional community. Ideally, the Ondonga Traditional Authority should have investigated and reported to my office. Now, the minister talking on the findings and remedial actions through the office of the governor. Question number 2. The response to this question can only be obtained from the Ondonga Traditional Authority following an inquiry to this issue as stated earlier. Question number 3, that can only be actually established following conclusion of the inquiry through the Ondonga Traditional Authority. Question number 4, the response to this question connects to the responses cited earlier. Question number 5, an official stamp may be removed in an event where the headman ceased to occupy that position. This includes handing over of all documents and other legal instruments at the disposal of a former headman concerned, based on the processes that I have alluded to earlier. Question number 6, remedial action from the office of the minister shall be preceded by the official communication to this effect by the Ondonga Traditional Authority, as that will only inform or guide the minister what will the way forward be. Question number 7, the answer is as stated above. Question number 8, remedial actions shall be linked to the findings of the investigation by the Ondonga Traditional Authority once again. Last but not least, question number 9, as indicated earlier, Madam Honorable Deputy Speaker, honorable members, internal mechanisms in line with the governing legislation shall be duly enforced in our quest to restore the situation. I so submit, Honorable Deputy Speaker.
Follow-up question. Thank you very much, Honorable Deputy Minister, for the partial response. I think I want to ask you, because since you are now mentioning that your ministry is, it will be remediate or taking some remediation between Ondonga and you. I think for me or for us, it is inappropriate to go there and found the answer from the person who committed a crime. You are the responsibility, the responsible minister, ministry. Please, we need that one, that answer immediately, because that is in violation with the Article 21. Else, thank you very much.
Very good.
Okay, thank you. Question 194, Honorable Haikola, to the Minister of Environment. Does Honorable Haikola pose the question?
Yes, I support.
Thank you, Honorable Minister.
Honorable Deputy Speaker, I would like to seek your intelligence again. Maybe I came rushing. It looks like I have not taken the right take of answers.
Okay, this question is deferred. Question 195 by Honorable Kambala. Is there anybody on behalf of Honorable Kambala? Yeah, Honorable Angula. Just wait. Okay, thank you, Honorable Tayele.
Brother, honorable member, for allowing us to dispose of some of these outstanding questions. Yes, Honorable Deputy Speaker, honorable members, I was advised to go straight to the answers. The implementation of the power vested in Section 3 and 4 of the Act does not require the minister or the ministry to grant approval for operationalization. That option is already available to the NHE Board of Directors, and they are busy exploring options to operationalize the housing finance provisions. Question number 2. NHE is already operating as a fully fledged housing finance institution, but not a bank. It's basically just there to provide mortgages to its clients. All what is required is capital injection to boost the institution's equity, which allows it to extend loan books, balance sheet, and increase the capacity to borrow more capital. As it applies to any other public enterprise, the government is prepared to provide guarantee to credit providers from which NHE is prepared to secure funding required for the working capital. I so submit, Honorable Deputy Speaker.
Thank you.
Straight to the answer.
That brings us to question 196. No. Yeah, 196. Minister is not present. 197. Honorable Lucato.
Honorable Deputy Speaker, I pose question.
Okay, thank you, Honorable Minister. No, okay, then the question stands over. 197 stands over. Honorable Lucato, Minister left. Can I come back, Honorable Minister Agriculture? Oh, okay. That takes us to 198. I think table office, just be consistent. When you use surname, use surname. When you use Honorable Likando, 198. You are Rodriguez.
I put the question.
Thank you, Honorable Minister. Table office. You take note, me. Yes, Honorable Minister.
I would like to defer the question again.
Again, okay. I like
so
the,
as the following one.
No, but we must put it on record.
Or is it too?
Okay, thank you. Question 199 of Honorable Mongo. Is there anybody on her behalf? Honorable Fries.
Yes, Honorable Deputy Speaker, I put the question on behalf of Honorable Mungo.
Thank you, Honorable Minister. No, Honorable Minister, it's actually my Honorable... No, I must call your name so that the light comes red, and then when you answer, it's captured by the record. The Minister of Environment, the name is gone, Indileni. I call another name, so it's the name in my head. Indileni Daniel. Honorable Daniel, you must press. Honorable Daniel, yes.
I would like to defer that one as well.
Thank you. Then that brings us to question 200. The Minister is not present and leaves us with question 201 of Honorable Sisiku. Do you pose the question, Honorable Member? Honorable Sisiku?
Yes, Deputy Honorable Speaker, I put the question.
Thank you, Honorable Minister of Health. It seems you are the star today.
Thank you, Honorable Deputy Speaker. Thank you, Honorable Member. In brief, the Ministry is still guided by the Hospitals and Health Facilities Act number 36 of 1994. This act provides for the registration as well as for the licensing of private hospitals and health facilities based on strict requirements, of course, that these facilities must ensure to oblige to. Now, in accordance with this act as well as its regulations, private hospitals and health facilities are required to apply for renewal of their licenses every year, so annually. As part of this renewal process, our health inspectors do conduct inspections of these facilities to assess their compliance with established standards, protocols, and requirements. Now, these inspections cover a range of critical areas such as infrastructure and equipment. So firstly, ensuring that the facility has adequate infrastructure, well-maintained equipment, as well as appropriate resources to deliver quality healthcare services. Secondly, hygiene and infection control, verifying that the facility adheres strictly to our hygiene standards, protocols, as well as infection measure control to prevent the spread of infectious disease. Staffing and qualifications, assessing the qualifications as well as the competence of healthcare professionals employed at the facility, ensuring that they are registered with the relevant professional bodies and possess the necessary skills to offer the necessary care. Then there is waste management, ensuring that the facility has proper waste management systems and proper places for the disposal of wastes, segregation, collection, storage, as well as the transportation of anything hazardous. These inspections are crucial in order to ensure that the conditions and services provided to patients are met at the required standards, because yes, they are private facilities, but they still fall under the purview of the Ministry of Health and Social Services. So yes, we are still responsible for private health facilities and the quality and the standards of care that are offered at these facilities. Question number 2, Honourable Deputy Speaker, Honourable Member, I acknowledge the concerns raised by the Honourable Member regarding the alleged practice of private medical doctors leaving their firms in the hands of unqualified individuals. Now, at the time the question was posed, the initial answer was that should such evidence be received, the Ministry would conduct such investigation. However, after this response was prepared, such allegations were then brought to my office of 2 such cases. Such cases have been investigated. Preliminary investigations are underway, and this will allow us to be able to provide a report on the matter. But also, we have received reports that this is not, or these are not the only cases. And so, yes, the Ministry is currently working to ensure that despite the fact that inspectors inspect the facilities, there must be periodic, so to speak, inspections to ensure, sometimes even impromptu inspections, to ensure that the necessary doctor that has the license for that facility is present at that facility and does not, for example, as has been allegedly reported, leaving interns behind to manage private facilities. Question number 3, Honourable Deputy Speaker, Honourable Member, given the seriousness of these allegations, an investigation into these practices was launched, but we also found the need to then take a look at the entire country as a whole and perhaps use it as an opportunity to fill the gaps where we find that perhaps within our regulations or our inspections there are gaps that must be filled. This includes the review of licensing and accreditation records, surprise inspections of private health facilities, collaboration with HPCNA, the Health Professions Council of Namibia, to investigate allegations of professional misconduct and to take disciplinary action against healthcare professionals that are found to be in violation. I do want to assure the August House that the Ministry will, once these investigations have concluded, take swift and decisive action as the matter is concluded, but also, as mentioned, take the necessary steps to plug the gaps that have been found or will be found in these investigations. Question number 4, Honourable Deputy Speaker. The Ministry monitors the services of private health facilities through annual license renewal inspections as mentioned. However, we recognize that annual inspections alone may not be sufficient to detect and address all instances of substandard care. Therefore, in addition to annual inspections, the Ministry also conducts targeted inspections in response to complaints or reports of alleged violence. We do also encourage members of the public to come forward and report any concerns that they may have about the quality of care provided. So far, the Ministry of Health and Social Services from April 2026 launched our customer care desks at 7 facilities, of course with a plan to roll out at other facilities. But we also take note that same such customer care lines must be created for complaints to be raised also regarding private facilities and not only state facilities. And so the Ministry is actively looking into this. Question number 5, Honourable Deputy Speaker, Honourable Member, the Health Professions Council plays a crucial role in regulating health professions and ensuring that only qualified individuals are registered and licensed to practice. Thus, there are several security measures in place. These include HPCNA register. The HPCNA maintains a public register where members of the public must verify the registration status of healthcare professionals. This includes all healthcare professionals, myself included, am mandated to continue to renew my license every year to be recognized as a medical doctor. Practicing cards, registered medical practitioners are issued with practicing cards by the HPCNA annually. Patients have the right to request to see the card before receiving medical care. So yes, some education must also be done to public members because they do have the right to request to see that card when perhaps they are in doubt of the qualifications of the medical practitioner. Then ethical guidelines. The HPCNA has ethical guidelines in place that places a duty on practitioners to refrain from employing a health professional with restricted registration, such as an intern doctor, a student doctor, a locum, or perhaps a doctor which is not Namibian and does not then have the license to practice. However, we do take note that still there are doctors that choose to do the opposite. Legal framework, the Health Professions Act number 16 of 2024 provides that no establishment, institution, or employer, whether public or private, may appoint or allow a person who is not duly registered or licensed to perform acts that are reserved for registered healthcare professionals. A breach of this provision is an offense that is punishable by a fine of up to 100,000 Namibian dollars or imprisonment for a period not exceeding 5 years, or both. Unregistered persons providing healthcare services may also be reported to the Namibian police in order to create a criminal case. Patient charter. The patient charter stipulates that patients have the right to know which practitioners are providing them with care. The Health Professions Council of Namibia disciplinary procedures. They have prescribed rules relating to the acts and omissions that would constitute improper conduct or misconduct. In that light, the Ministry has also received multiple complaints of doctors that are allowing others to prescribe on their practice number. Once again, this is not permitted, and we take these complaints seriously, and the necessary investigations are underway. Public awareness, in conclusion, the Health Professions Council of Namibia encourages members of the public to lodge complaints if they suspect that unqualified or unregistered individuals are attending to patients. However, the ministry also does take note that these particular cases that have been brought to light by the honourable member, as well as through official complaints to my office, point that a gap must be filled. Thank you very much.
Thank you. The follow-up, Honorable Sisuku.
Thank you very much, Deputy Speaker. Thank you very much, Honorable Minister, for the response that you have given to me. I just hope such investigation will be concluded within the reasonable time frame and the report back to this Assembly for the benefit of the Namibian people. Thank you.
Thank you. More comment than anything. I think you make that undertaking, Minister. Minister? Minister of Health, Livingdown.
Deputy Speaker, we will do so. We will provide the report to the August House.
Thank you. We have disposed of question 201. Question 202, the Minister is not present. Stands deferred. Question 203, Minister is not present. That brings us to question 204. Honorable Aitota, do you put the question? Chief Whip.
I put the question.
Thank you. Honorable Minister of Agriculture.
Thank you, Honorable. Thank you, Honorable Deputy Speaker. Just for the record, I'm now also ready for the other questions. So.
Okay, we can go. Which number?
186.
Okay.
So let me address this one, 204. Honorable members, I rise to provide a response to the question raised by Honorable Haitota regarding the provision of safe water and adequate sanitation services for all Namibians, with particular emphasis on rural communities. First and foremost, I must state that ensuring access to these essential services is not only a fundamental human right, but also a constitutional and moral responsibility central to our development agenda, social equity and national cohesion. The government acknowledges that access to clean water and sanitation is fundamental to health, dignity, and economic growth. In alignment with this principle, the Ministry is advancing initiatives through the Rural Water Sanitation and Supply Program, prioritizing regions with the greatest needs. According to our records, notably, in 2023, 63.8% of the rural households remain without adequate sanitation services, compared to 20.3% in urban areas. In 2024-2025 financial year, 782 sanitation facilities were constructed, with 691 completed by regional councils. An additional 769 facilities were established in the first quarter of the 2025-2026 financial year, resulting in a net increase to rural water sanitation of about 0.5%. In 2024-2025 financial year, the Ministry allocated 14 million to regional councils, accounting for 44% of the total sanitation budget, along with 14.48 million dedicated to material procurement. To further accelerate progress, the Ministry convened a National Sanitation Symposium in Zambezi region in October of last year. Progress has been achieved in expanding water accessibility in rural areas. During the 2024-2025 financial year, the Ministry drilled 117 boreholes, installed 251 sites, rehabilitated 14 water pipelines, and restored 161 water points across the country. In addition, 26 short pipelines were constructed, 65 boreholes drilled, and 107 boreholes installed. In addition, major projects undertaken last year included the commissioning of a Kangwati or Hamaremba water scheme in Kunene region, as well as Onamatanga in the Umusati region. We also installed 20 mini desalination plants across the country where the water has shown to be saline. To address the maintenance and sustainability of existing infrastructure, an investment of 53.5 million was allocated to Regional Council for water infrastructure maintenance, with an additional 13 million for materials included. Community-based management and training initiatives are empowering local water committees to manage infrastructure sustainably. To conclude, Honorable Deputy Speaker, it is imperative to know that despite ongoing challenges, the Namibian government remains dedicated to achieving universal access to water and sanitation. By making these strategic investments, strengthening institutions both in terms of human resources and financial capacity, and fostering effective community partnerships, we are closing the gap to ensure equitable access for all Namibians. Providing safe water and dignified sanitation for every citizen reflects our shared vision and aligns with our constitutional obligation and demonstrates the political resolve of the government. Thank you very much.
Thank you. I now also give you the floor and put question 186 straight to the answer. The question was already posed. Honorable Inge. Honorable Inge.
Yeah, mommy.
No, I'm just saying for him to get your read. That's why I just shortened.
Well, Inge is my first name.
Oh, okay.
Honorable Deputy Speaker, I rise to provide response to a question that was asked by Honorable Lucato last year relating to an announcement that was made by my predecessor, which he termed the status of billion-dollar borehole drilling and water infrastructure project across various regions. I wish to begin by thanking Honorable Member for this timely and pertinent inquiry. While I appreciate the concern raised by Honorable Member, it is essential to present the facts, which demonstrate that significant progress has been made and continues to be made under this initiative, particularly in rural areas where water access is most urgently needed. It is important to note that the assumption of government inaction does not entirely reflect the reality on the ground. The project that was referred to was a action memorandum, which was submitted by the former minister to Cabinet in 2025, outlining the number of strategic initiatives and projects that are needed to be implemented in order to increase water supply across the country. According to that memorandum that was submitted,
The cost then was estimated to be $13,821,000, which was requested to fund these projects. Unfortunately, of this amount, only $1 billion was made available, which was allocated towards the development of water supply resources in communal areas and in resettlement areas over a 5-year period. And this included construction of 30-kilometer short water pipelines nationally at a cost of $240 million. Rehabilitation of 10-kilometer short pipelines nationally at a cost of $40 million. Rehabilitation of 983 water points at a cost of $245.7 million. And connection of 25,000 private offtakes at a cost of $100 million. There was also a budget for drilling of 291 boreholes, as well as an installation of 646 boreholes across the country. Therefore, honorable members, the cabinet decision, which was the basis of the honorable member's question, was yet to be fully implemented owing to the outstanding financial commitment that was required. However, it should be noted that the ministry has received 123 million Namibian dollars for the 2025-2026 financial year towards the drilling of boreholes, the installation of water points, construction of pipelines, and rehabilitation of boreholes and water points. This, by implication, resulted in a shortfall of 657,701,000 Namibian dollars if the projects that were listed in that memorandum was to be fully implemented. In addition, honorable members, I am pleased to inform this August House that during the financial year 2024-2025, the ministry made significant progress in expanding access to clean and safe water across the country. A total of 117 new boreholes were drilled, 251 boreholes were equipped and installed. These efforts form part of our broader national strategy to ensure that all Namibians have access to reliable, potable water of adequate quantity and quality in line with our national goals and commitments. Honorable members, as I see my time is going to conclude, the House should take note that as much as the ministry wishes to expedite their activities as planned to improve access to water, both in rural and urban areas, procurement processes continue to pose challenges in fast-tracking the implementation of water supply projects countrywide. In conclusion, the ministry remains committed to developing appropriate infrastructure solutions guided by technical studies, environmental safeguards, and community engagement, all within a broader framework of our national development goals. I wish to assure this August House that we will continue working tirelessly to strengthen water supply provision by ensuring equitable access to water for all our people within the limited resources at our disposal. Thank you, Honorable Deputy Speaker.
Thank you very much. Any further clarity-seeking questions? Come again? No, I need to be fair also to the member who asked the question. That said and done brings us to the adjournment. I will ask now, Honorable. Honorable Chief Whip, no, it's you. We sit in ranking, number 1, number 2. Honorable Nekundi. Is it Honorable Kapofi? We sit number 1, number 2, number 3, number 4. Honorable Nekundi, please adjourn the House. We sit according to ranking. Yeah. Huh? Just adjourn the House.
I would like to adjourn the House to next week, Tuesday, 2:30.
Thank you very much. Okay, the House stands. Okay, next time.